Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban, and we have a fantastic episode for you. Why? Because we're going to be talking about plastic surgery myths, snake oil. As everyone knows who follows me, who listens to our podcast, I'm all about transparency. I hate all the nonsense, bullshit marketing of plastic surgery. We're an amazing profession, do amazing things, but there's a ton of garbage out there. And as a consumer / patient, you never really know what is or isn't real. And now in the world of AI and Photoshop and photomorph, it's just even more confusing. So there are 4 things that would be arguably trillion-dollar businesses. That's right, not billion, but trillion-dollar businesses if they actually worked, but in reality they don't. But they are marketed, they are pushed, they are sold, and we're going to discuss all 4 of them today. Trust me, if these 4 things actually occurred or worked, it wouldn't be a hem or haw. There is no discussion that Botox works. There is zero discussion that Viagra works. There's no discussion that Ozempic works. There is no discussion about hair transplant. These are solid items that we've advanced in aesthetics or in the world of medicine that there's no discussion about. No one's going to be like, well, I'm not sure. It works. But these 4 subjects that I'm about to cover with you are, I don't know, sort of, kind of, and anything that's like that just isn't, right? This should be very, very absolute, and there should be no discussion around it, and every plastic surgeon should be able to offer this to you. So let's start from the top. Number 1, biggest myth is that you can go into a doctor's office and non-surgically tighten your skin. Did you hear me? I can walk into Dr. Joe and Schmo's office and or spa, and I have a little loose skin in my neck, a little loose skin in my arms. I'm not crazy about the little bit of loose skin in my belly, and I don't want surgery. I sure as hell don't want a bunch of scars. I don't want any downtime. I just want a little something, and I'm going to go and do a device, use a machine, and that machine is magically going to tighten my skin such that, and here's the kicker, I look better. It's reproducible, meaning I did it, my mom did it, my sister did it, my brother did it. They all got benefit, and it's worth it. Oh, and by the way, there's no downside. So, of course that's not true. If there was a device, just think about it for a second. If there was a device that tightened your skin, let's say it tightened your skin, and then the argument that all these people make is, well, of course it's not as good as surgery, but it's not surgery, so you get less, but it's still good enough. That's not true. If there was a device that tightened your skin 25% of what surgery does, sign me up. Sign me up. Like, I get it. It's not surgery, but it's good enough. It doesn't. None of these things do shit. And there have been hundreds of them, and there will be hundreds more. I'm not saying there'll never be a device. I am sure with the advances we make, God, for the love of God, there's cars driving by themselves. I'm sure eventually there will be devices that can shrink skin consistently, reproducibly, and effectively, at which point I will have 15 of them. Might be out of a job because, with the exception of like a nose job and a few other things, boob job, we're trying to remove skin with facelifts and tummy tucks and arms and what have you, but there will be no discussion. So you go into an office and they do this machine, and then you get swollen, and then you go home, and of course, naturally, for the first day or 2 or weeks, you're swollen. You think it's kind of tighter, you think the skin feels a little better, and what do you know, within a couple of weeks to months, you're like, wow, that was underwhelming. So I just blew whatever amount of money. Mind you, they're always like, you need to do 3 to 5 rounds of whatever it is that you're doing, of course, because why would they take your money once? They need to take your money 3 to 5 times. And at the end, I guarantee you, you'll be underwhelmed because there is no such device that exists. Again, when and if that occurs, it will be literally headline news everywhere in the world. The next thing is that there is some way, some device, some machine, some laser that removes scars. Again, I'm going to do a surgery on you. Facelift, gallbladder, hysterectomy, hip replacement, whatever. Cut is made. That cut turns into a scar. Now we have horrible, ugly, hideous, thick scar. We have thin, barely visible, oh my God, I can barely see it scar, but it's still a scar. So again, this notion that I can walk into somewhere, usually it's some spa, and they're going to use a device or a laser or an injection or something, and that scar is going to go away is nonsense. As a plastic surgeon, the number one thing that is inhibiting my patients from booking surgery and spending a boatload of money with me is scars. So what do you think? Don't I have an incentive to utilize these methodologies or devices? If I could tell a patient, hey, listen, you want to get a breast lift? Don't worry about the scars. There'll be no scar. I'm going to use blah, 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 and your scar will disappear. Sign me up, Dr. Rahban. I'll have 1,000 more patients a year signing up for surgery if I could get rid of their scars. Obviously, you can't get rid of the scars. What you can do, which we've spoken about many times, is you can make scars really, really minor by doing an amazing job closing. That's right, the surgeon needs to sit there and spend time and sew everything together layer by layer, tension-free, no crushing, no ischemia, et cetera, et cetera. Nobody wants to do that, time-consuming, et cetera. So that's all bullshit. Next, oh my God, the dreaded cellulite. Cellulite, chasing cellulite. Now, maybe we made a little bit of progress in here because over the years there have been devices. So what is cellulite? Cellulite is a dimpling of your skin with a little bit of a septate or some connective tissue that kind of puckers your skin down and creates that pitting effect. Well, obviously it's something that is very unsightly. It bothers a lot of people, mostly women because of the genetics. And the idea is that there's some cream or lotion or something or another that can remove that cellulite. Again, if there was a device that got rid of cellulite, how many women in the world have cellulite? Let's just take a random guess. 10% of women have cellulite. There's 8 billion people, 51% of them are women. That's 4 billion people. 10% of 4 billion people is a lot of people. Do you know how much money I would make if I could get rid of your cellulite? So the only thing that's come close, and I still think it does a shitty job, is there is a procedure in which you can go underneath the skin and try to sort of cut and disconnect those scar tissue, that septate, and let that pitting relax, and maybe it'll improve. I would argue that currently it's not very effective, it's not very good, and you'll probably get very little exchange. Whether or not you want to try it or not is up to you, but it's certainly not going to remove it, and it absolutely is not currently considered a treatment or cure. So, buyer beware. The last and final myth or misinformation is the ability to remove stretch marks. Stretch marks are forever. They are forever. They are a type of scar. So I cut you with a blade, you generate a scar. You stretch too fast, your skin doesn't have time to react. The dermis, you have the epidermis and the dermis, that's your entire skin, doesn't react fast enough, and the collagen and elastin breaks, and then you, through the skin, can see that sort of weird look that we call a stretch mark. That is a type of trauma and or scar that your body has generated. So again, no lasers, no machines, no microneedling, nothing will get rid of your stretch marks. Nothing. Now, what you can do, which won't get rid of your stretch marks, is actually you can tattoo them to camouflage them and or hide them, which would be the equivalent of putting makeup on them. Obviously, tattoo can be semi-permanent and last a long time. But for sure, do not be under any illusion that you're going to walk into Spa X on La Cienega and that person's going to pull out device Y, do a couple of treatments, and voila, there goes all the stretch marks from your delivery or the stretch marks on your chest from working out. It's not going anywhere. So if any one of these 4 things, I will repeat them for you: skin tightening, scar removal, cellulite removal, and removal of stretch marks was a real entity. I mean, it was literally worked. Like you came in, I put an implant in, you left, your breasts are larger. There's no question about that. It's actually larger. If it worked in that way, you don't think the entire world would know about it? How many people have not heard of Ozempic? Zero. The world, there are Africans in a tribe in the middle of the Amazon that have heard of Ozempic because it works. And the second it worked, it became ubiquitous, like tissue paper. So there is no device, there is no procedure, there is no cure or treatment for these four things as of yet. Do I think they might happen? Sure. Am I hopeful? Sure. Will you know about it? Absolutely. It will not be just my doctor. Oh, my doctor, you guys, you have to go to my doctor. Because my doctor, he has this thing. What, your doctor's the only one that they sold the device to? Like they didn't sell it to anybody else? So it's bullshit. I really want you to listen carefully because I have so many patients who have wasted money and time and energy on these types of things with zero return on their investment. At any rate, that's a sort of a cautionary, quick and dirty podcast on 4 of the most common plastic surgery myths. Beware. So at any rate, that was one of my fastest podcasts we were going to do. We wanted to just get it out there in its own entirety. We try to get it out on social media, but I can't talk for 15 minutes on social media. And so I always have to speak I can't give it as much detail as I need. So at any rate, that's going to be a wrap for this particular episode. As always, whenever we have an episode, we tell you 2 things. 1, please go write a review. We love reviews. Go write something positive. The world needs more positivity. If you have nothing nice to say, please don't write it. And secondly, share this podcast with every person you know. Why? Because you have no idea who's going to do what, when, where, and the next thing you know, by the time they tell you, it's too late. They already made a mistake. So share our podcast with everyone you know. All right, guys, that's a wrap of this week's Plastic Surgery Uncensored show. We'll see you next week. I'm your host, Dr. Rady Rahban.